Good evening, everyone. Thanks for joining us. We're just going to give it a moment or two to allow everyone to join and get settled. Hey, once again, good evening and a very warm welcome to our webinar on varicose veins and Thermavein treatment. My name's Vicky and I'm hosting the session this evening. Delighted to be joined by expert speakers, Mr. Aaron Sweeney, Consultant Vascular Surgeon, and Dr George Taggart, Private GP and Thermavein Specialist. Tonight's session will begin with a presentation from Mr. Sweeney and Dr. Taggart, followed by a live Q&A. If you've got questions at any point, please feel free to submit them using the Q&A icon at the bottom of your screen. You're welcome to ask anonymously or include your name, but just a quick note that as the session is being recorded, any names shared will be visible in the recording. And to help us get through as many questions as possible, we'd ask you to please keep your questions brief. If you're interested in booking a consultation, we'll share all the relevant contact details at the end of this session. So I'm going to hand over to Mr. Sweeney, and you'll hear from me again later.
Good evening. Thanks very much for joining us. Just run through a few things. That's me. I'm a vascular surgeon. I qualified quite a long time ago now and became a vascular surgeon, a consultant in 2002. I've done quite a few thousand of these procedures over the last 20 or something years, and we do very large numbers here per year. I'd like to say I introduced EVLT, but that was me and another surgeon in London, and it kind of took off, but that's quite a long time ago now. So the treatments we talk about now are not necessarily brand new, they're just proven to work.
Good evening. My name's George Taggart. I also qualified quite a long time ago at St Thomas's Hospital back in 1991. I've been a GP in East Sussex since 1999 and developed a special interest in treatment of thread veins back in 2017. And I've been actively working in that field ever since.
So essentially, we're going to just run through what we do and a little bit of, hopefully, at the end, you'll have some understanding of what varicose veins and thread veins are. We'll give you a few treatment options, and then what's really important is the Q&A session at the end. Many people tune in with questions they already know exactly what questions they want answered. So I'll be as brief as possible, try my best to give you a little understanding of what I do, and then hopefully we can take a load of questions that make it a bit more clear. So we usually tell you the CQC rate of this hospital is outstanding, which is pretty unusual, and it's quite a nice place. Many people have been down here before. It's brand new, super clean as well. So varicose veins, I think I usually tell people that varicose veins, you think of your veins rather like a Christmas tree. So you've got a big artery that takes all the blood down your leg and a big vein that takes it all out eventually. So if you think of it as a Christmas tree, you've got a large trunk in the center, and then you've loads and loads of veins joining in, rather like a Christmas tree. The big veins are draining muscle. They're surrounded by muscle, so there's a little bit of squeeze helping everything to go uphill, because vein blood comes from your toes, up your leg, up to your heart to be pumped again. So the big veins are generally draining muscle, and the small ones are draining skin. And you have hundreds and hundreds of these veins. They're normally tiny little things, less than the size of a shoelace. And a million years or so ago, when we were walking on all fours, they were all draining happily. And then we've decided to stand upright, and that's created a problem because the veins just sit under the surface of the skin. They're not surrounded by any muscle. And the only thing keeping things going uphill are little tiny valves that occasionally break. When those valves break, it allows blood to pool, and it depends what size vein you have. If you have a small vein, it may not make much difference to you, but if there are larger ones, Often it gives you a bit of ache and pain. They appear as bumpy, large blue veins. The achy and heavy legs, which is nearly always worse in the evening. Your ankles sometimes swell. Occasionally people get ferocious cramps at night and are jumping out of the bed. And you can get dry, itchy skin, nearly always in the lower part of your leg. There are a couple of grades. We talk about them 1 to 4 or beyond. Grade 1s are usually what we call cosmetic thread or spider veins, which Dr. Taggart is an expert in. We often treat those with just sclerotherapy. We also treat grade 2, so if you can just about feel them, they can also be treated. And then when they get a bit larger, grade 3 or grade 4, means they're palpable, they're sometimes sore, they occasionally give you a little bit of trouble with your skin. Because remember, all of these skin veins are draining little bits of blood, about a tiny amount each minute, all uphill. And if they're not draining, in many people, causes no trouble whatsoever. But in quite a few people, the old blood irritates the skin, and the skin can sometimes change color, go a little darker, often get itchy, sometimes go red, and can become quite inflamed. Ultimately, you can get an ulcer, but I won't leave that slide on too long. But ultimately, you can get an ulcer, but that's pretty rare. For most people, they have varicose veins for donkey's years. They're not usually that troublesome. They can occasionally be painful, but most people have loads of other things to deal with in life. Normally, people come to see me after around about 10 years or so with achy legs, or when their legs start to give them a lot of itching, or the skin starts to change color. So if you come and see either of us, you get a full consultation. I usually do an ultrasound in the clinic, which is a great way of seeing everything under the surface. I show it to you. I like to draw diagrams so that you understand things fully. And you can have your procedure booked straight away, or you can go away and have a think about things. We deliberately try not to press you into having things done. So most people know that varicose veins were previously treated with operations that were, in general, a bit brutal. They were called stripping, and it's where cuts were made and a metal instrument was used inside the vein and everything was pulled out. That was kind of okay. It did remove the veins, but quite often it resulted in new veins appearing. So many people who had stripping operations in the past had new veins appearing in the years that followed, and often had a pretty terrible time. We now try to do minimally invasive treatment. It started quite a while ago. It really started around 2000. It came to the UK a little bit after that, and really since 2005, that's almost the only way that I have been treating veins. The treatment is called EVLT, or endovenous laser treatment, but there are many different types of treatment. They all involve using putting something up the inside of the vein. It looks like a little wire. In my case, it's a laser, but there's plenty of other different types of heat that you can use, and they're all pretty good. We perform quite a few operations here. This is the inside of the right thigh of somebody, and if I tell you that there's the big artery and vein up there and right on the groin crease, and then you have a vein running down the inside of the thigh, which is the commonest vein to not work. And we pop a little laser up that and then gradually laser down the inside lining of the vein. Now, lasering is a way of heating it up, so it can be a little uncomfortable. And so to avoid that, we usually inject a little bit of local anesthetic around it, but you don't have to have local anesthetic treatment. Many people choose a general anesthetic. I don't think it matters. We use an ultrasound scanner at the time just to make sure we're in the right spot, and you can watch it if you wish, or plenty of people don't bother. So sometimes you can use a heat as the main source, but other times you can use a chemical. Often people hear of a treatment called foam sclerotherapy, which I do use, normally for smaller veins. I think it works well for those. I don't particularly think it works brilliantly for larger veins, and I prefer to use a laser for those. But there are other terms called such as radio frequency ablation, Clarivein, etc. And if you think of them, most of them use heat. Some of them use a small bit of chemical, And what they're designed to do is to minimally damage the vein without doing large incisions or pulling the vein out. So when you look at this, is a left leg, and typically veins appear in the lower part of the leg and the calf, but actually the trouble often arises in the thigh. So we laser the vein and somebody comes back a few weeks later. Normally everything deflates, and if you wait long enough, it normally looks okay. But if you look carefully there, you'll see that there are still a few veins visible. So if you're not bothered about how it cosmetically looks, we do it that way. If you don't like the look of any bumpy veins, we can certainly remove those as well. We do that, it's a technique called phlebectomy, where we do a tiny little incision, and I have a little instrument that goes under the surface and breaks up the vein. It does bruise you a bit, but looks pretty good a few weeks later. I'll hand you over to Dr. Taggart.
Thank you very much. So Mr. Sweeney has told us about the treatment of larger varicose veins, but at the other end of the scale are the small grade 1 or thread veins, which typically cause trouble to people on the face and legs. Thread veins generally do not cause any physical symptoms. However, for many patients, they can cause significant cosmetic concerns and problems with self-confidence. So here at Benenden, as well as the varicose vein treatments, we have well-established, safe and effective methods for the treatment of the thread veins. So for treatment of thread veins on the legs, we use a technique, as has already been mentioned, called microsclerotherapy. And this involves the injection of a liquid, or sclerosant as we call it, into the vein. We either use a concentrated saline solution or a detergent-based sclerosant. These liquids, upon injection into a thread vein, cause a reaction to the lining of the vein wall, which leads to clot formation, fibrosis or scarring, and eventual closing down of the vein. Once the vein is closed down and empty of blood, it becomes redundant, and it eventually becomes reabsorbed into the surrounding tissues, and then it is no longer visible. An appointment for microsclerotherapy would consist of an initial consultation, including a careful examination and explanation of any proposed treatment. Subsequent appointments for treatment last 30 minutes. Multiple injections are usually performed, depending obviously on the number of veins requiring treatment. And at each injection site, a small dressing is applied, which needs to be kept dry and in place for about 3 days. It's an outpatient procedure, and normal activities can be resumed and indeed are encouraged immediately. We want you to stay active after this treatment. Typically, patients require a course of treatment, and each appointment would be 1 month at least apart. That gives the patient time to assess the success of the treatment and the need for further treatment. For the treatment of facial thread veins, we use a technology called Thermavein. Now, this technology was established in the late 90s and has been extensively and successfully used in vascular clinics ever since. At Benenden, we are using the most up-to-date version of the technology currently available. Attached to the Thermavein machine via a wire is a tiny nickel probe, which you can see on the end of the probe there. The wire is insulated along its entire length, which ensures that all the energy from the machine can only exit the wire from the very tip, and the wire is not far off the width of a human hair. So this means we can use low energy and deliver it very accurately, which minimizes the potential for any side effects. So using the probe, slight pressure is applied to the skin overlying a thread vein, and this blanches the vein, and then with a short burst of energy from the machine, delivered with pinpoint accuracy, we heat the wall of the vein up, and this causes it to collapse and stick together at that point. We then move the probe 1 to 2 millimeters along the vein and repeat the process. And as we go along, the vein is sealed. The vein is now shut down and empty of blood and is no longer visible. As with microsclerotherapy, if we can keep the vein shut down for long enough, the body reabsorbs it into the surrounding tissue. Here I have a video of someone I treated 10 days ago, which shows the treatment in action, and then some pictures of the area before and after treatment. So we'll just have a look. As you can see, mild pressures applied to the skin, and the probe delivers a pulse of energy. Same again on both cheeks. Here we can see a very small hemangioma, which is a blood vessel come to the surface. And the after picture, you can't see it anymore. And again, a prominent thread vein on the which has before and after treatment pictures. And we have one more. Thermavein is an excellent treatment for red and purple veins, thread veins on the face, vascular blemishes anywhere on the body, and it can also be used in addition to injection sclerotherapy on the legs for veins that are too small to inject. During the treatment, we apply heat energy to the skin from the machine, and this usually results in a mild inflammatory reaction. As you can see, the cheeks are left slightly red and a little puffy. This usually lasts for 2 to 3 days. Occasionally, it can last a little longer, but that's uncommon. Here we can see an area that has been treated, some prominent thread veins on the nose, and afterwards again we see an area of inflammation, which, as I say, usually settles after 2 to 3 days. After the treatment, we use aloe vera gel, and this really is very soothing to the skin, and we recommend that you continue to apply this until the inflammation settles. Most patients require a course of treatment. The number of treatments, again, depends on the extent of the thread veins. And we tend to try and estimate the number of treatments you'll require at the initial consultation, and also would discuss any other conditions that cause inflammation or redness, such as rosacea. If rosacea is present, we often use a cream prior to starting the Thermavein treatment. As with the leg treatments, treatments are 1 month apart, and this allows the skin to completely settle and for the patient to assess whether they need more treatment or not. So in summary, thread veins are a very common issue. They can be debilitating for some patients. In microsclerotherapy and Thermavein, we have well-established, safe and very effective techniques for their treatment.
Okay, thank you both very much. Let's move on to our Q&A session. We're delighted to have so many of you with us this evening. We might not be able to answer every question, but we'll do our best to cover as many as we can. And on this slide, you'll find some pricing. So our first question, I'm a 74-year-old active man. 30 years ago, I had varicose veins in both legs stripped out. I now have new varicose veins, mainly around the right knee. If I have EVLT, am I likely to have further varicose veins in the next 10 to 20 years?
Not necessarily. It all depends what you had done the first time. So quite often people are told they have their veins stripped, but actually when I scan you, I sometimes find there's bits left behind, or it isn't quite as extensive as you might have thought. So the reason I scan you when you come to see me is so that I can actually have a look under the skin, see exactly where the vein is coming from. And that normally allows me to tell you how likely it is that I can get rid of the vein, which is normally I can. But also I'm pretty straight with you if you're likely to have a recurrence. I have to say I'd be surprised if you've had an operation that long ago and then have just developed some new veins recently. I would say they may well be just a new, fairly simple vein, in which case, once it's treated with a laser, they shouldn't be back to bug you. When I talk to people about recurrences, I nearly always tell them that about 1% of people come back to me within a year to show me something. It's often a little side branch or a small vein that's very easy to treat. And when I laser veins, assuming they're done properly, I expect that about 10% of people after 10 years will develop a new vein somewhere else. It's nearly always the other leg. But if you are unfortunate enough to get a varicose vein when you're young, I think you're pretty likely to get one when you're a little bit older, no matter what treatment you have.
Okay, lovely, thank you. Next question. Are varicose veins at the backs of knees problematic, particularly if they've been repeated treatment over many years and new varicose veins have appeared?
Yes, they sometimes can be a bit of trouble. So most times when you see a varicose vein, it's fed by one single vein. Sometimes at the back of your knee, though, you can have multiple sources, so they can be troublesome, but not always. I would say that's unlikely. I think you're unlucky to have multiple treatments. And I would normally, again, do a little ultrasound, just see exactly what it is, because it can sometimes be remarkably simple and just the first operation or the last operation you had just may not have got the offending vein.
Okay, thank you. And please do ask your questions if you have any. One of the things that we get asked most frequently is after you've had EVLT, how soon after can you fly?
Yeah, so people are always worried about flying and getting DVTs. I think the risk of a DVT is really tiny on an airplane. The risk of a DVT following surgery on your veins is quite tiny. It's way less than, well, it's less than 1 in 1,000. But I normally say to people that if you come in and have your veins treated, the internet tells you that you're back to normal the next day. I tell you that it feels like you've just gone and exercised in the gym. You'll feel a bit stiff and achy. Most people could walk the dog if they wished, but they'd certainly know that I have done something to them. I think it takes you about 2 weeks to get back to reasonable speed without thinking about your leg. And most people take some kind of painkiller during those first weeks. It's not quite as bad as it used to be, but that doesn't really matter. If you're having your veins done, you want to know what it's going to be like in the first few weeks. I tell people that they could fly away the next day if they wished. There's no particular risk associated with that. But I once measured how far it is from the car park to the EasyJet gates in Gatwick, and it's a full mile. So I certainly wouldn't want to walk a mile with a bandage on my leg and perhaps a little bit of discomfort pulling it back. So I normally say to people, you get back to normal pretty quickly. You can certainly get back to work pretty quickly, but I would say normal activities take a couple of weeks. And I think it takes you about 6 weeks before you look down and can barely see that I'd be near you.
Okay. And what about sclerotherapy? Is that the same?
I usually tell people not to fly, certainly long haul, within a week of treatment, not because there's any association with the treatment and deep venous thrombosis, but we don't want any association with it. So again, there's no restriction, but it's best not to be undergoing a long period of sitting still after you've had treatment. But so 1 week would be my answer.
Okay, lovely, thank you. I've got a question from Linda. Linda says, I've got a cluster of spider veins behind my knee on my right leg. How is that treated? Do you want to say a bit about treatment for that?
Yes, I mean, what we'd have to do is have a look at your veins and assess the size and whether they're amenable to treatment. But it sounds if they're small spider veins, they would be very suitable for microsclerotherapy. Sometimes the veins are a little larger and require an ultrasound scan from Mr. Sweeney, but it's difficult to say without seeing them.
Okay, Linda, I hope that was helpful. Please do make a consultation. That's probably the best next step. And the next question is from Raymond. Raymond says, I've had a Doppler ultrasound and the GP's put me on a statin. Is it still safe to have my varicose veins treated?
Simple answer is almost certainly yes. Many people who come to me are on an enormous number of different tablets. It's normal. People can even be on blood thinners such as apixaban or rivaroxaban. It doesn't make that much of a difference. If you're on a statin, that's great, but that really doesn't make any difference to varicose vein treatments. It is interesting that sometimes people can have some very serious problems, such as heart failure, or have heart failure or atrial fibrillation and be on a blood thinner and have trouble with bleeding varicose veins. And I would still treat those because the risk is not that great, but the benefit is that you either get rid of the very swollen legs or indeed the bleeding point. So the simple answer to your question is certainly you can have your varicose veins done, and almost everyone's on a statin now anyway.
Okay, lovely. I hope that was helpful. So I think that is all the questions we've got for this evening. So thank you very much, everyone. If we haven't covered your question, that when you registered and you provided your name, we'll follow up with you via email. As a thank you for attending, we're pleased to offer 50% off your initial consultation, which is available if you book your consultation before the 31st of March. Also, a call back from your dedicated private patient advisor, an email with the recording of this session, treatment information and loyalty reward points, and updates on future events and health news. We'd really appreciate it if you could take a moment to complete the short survey at the end of this session, as it really helps us to improve and tailor our future events to your needs. If you'd like to speak to someone to book your consultation, our private patient team is available until 8:30 this evening and from 8 AM to 6 PM Monday to Friday, and you'll find their contact number on your screen.